Good Saturday morning to you, and welcome to the Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can find Dr. Bethaney Brenner in a couple of different places. Number one, she's got her office over in Burlington. You can also check her out online. I would say start there, theburlingtondentist.com, and you can call her. And matter of fact, I'm going to tell you, she's got this assessment here. It's a sleep assessment. She can give you a lot more information about it than I can. I'm, however, going to give you the phone number for it. And you can get it absolutely free by calling this number, 860-673-7155. Again, 860-673-7155. By the way, when you go to theburlingtondentist.com, there's a button that will link you over to the YouTube channel. So if you miss any of these shows, or maybe you came in late and you missed the early shows that we did months ago, or you had to leave early and it's like, oh, I wanted to hear the end of that. You can, on demand, you can play them. You know how YouTube is. You can listen to them anytime that you'd like. Again, it's at theburlingtondentist.com. Well, good morning, Doc. How are you? Good to see you.
Good to see you too.
Here we are in June already, huh?
I know. Can you believe it? We're warming up finally.
It finally is right. We got, I always say, I noticed this a few years ago. When I was a kid, I used to notice this I felt spring like immediately in April. And I remember hitting fall right in late September, early October, I think things have shifted a little bit because now it's almost like winter lasts or spring lasts now into May. But on the back end, there's plenty of 80-degree days. I mean, it's cool at night, but 80-degree afternoons in October. So it's almost like there's a shift.
Well, I would have agreed until this last winter because we started a little earlier and it's lasted longer. So, but we have weather cycles and they go on 20 and 50 and 100-year cycles. So, you got to deal with what you got to deal with. And so, I like it better when it's warmer. And the fall, I think, is so nice because we get those warm days and cool nights. I think that's why everybody loves New England anyway.
Well, you certainly get all four seasons here. There's no cold winters. We don't get much snow anymore. When I was a kid, my goodness, 2 feet of snow now.
Just wait.
Nah.
You're going to condemn us next winter.
Did I just jinx us?
Yeah, I think you did.
Talk about the free assessment before we get into the show here.
Okay, so the free assessment. So we have people that are now I'm doing free assessments for, and I think they're appreciating the fact that they can get some information about themselves. I go back to you guys out there, please fill out the forms. It is because I'm going to sit there and ask you all the questions anyway, and we just delay getting to the essence of it when you don't fill out the form. And I know it's a pain. I say this all the time. Everybody hates it.
Because it's so thorough.
It's very thorough, and here's why. Because I'm asking things that you haven't thought about. So don't just dismiss the whole checklist and go, I don't have any of those. And I get a lot of you guys are doing that, just saying. So I really need you to fill out these forms and be thorough. So take some time. We tell everybody it takes about an hour to fill out the form. Okay?
Really? It's that comprehensive.
Yeah, it is very, very. So we're getting down to what does the medical insurance need to say, or my sleep physician as well, to say that you have a problem that insurance is going to cover. That's the key. That's
so really they're helping themselves by filling out this form.
Exactly. Because if we can get medical insurance to cover this, and by the way, even if you have sleep apnea, then this one last fellow said to me, does that mean I need a CPAP? And the answer is no. We find the answer that's right for you. Now, can we facilitate a CPAP if that's your best answer? The answer is yes. We'll get a sleep physician who can do that for you. But not everybody needs or wants a CPAP. And I get that. I don't have one either. So I don't use a CPAP. But I treat my own sleep apnea. But yes. So why do we do that? Because we want to be healthier. We need better sleep. And what is so sad is that the ones that are sitting there going, I don't think I have a problem, but I might have a problem. Okay? Not sure I have a problem. And so when I do this, I'm able to explain why I'm seeing what I'm seeing and how this works and how the symptoms are very subtle. That's why it's not like if the sleep physician doesn't spend enough time talking to you, then all they can do is a test, right? And their test is one time. I run it for 3 nights because I want the sleep physician that I use to see the pattern. The other thing is some of the sleep tests, and we call them HSTs or home sleep tests. The home sleep test, I need what they call an RDI value. What does that mean? That means how your nose breathes. So it's that sniff through the nose, right? So we're looking for how well your nose is functioning. And that's important when we do this. It's a respiratory distress index in that. And we look at your oxygen desaturations too. We see how many events you have, how good your sleep is. We're looking at heart rate variability, and we've talked about some of these things on other shows. Right. All of this is in one fell swoop. But you might vary from night to night. And that's good. We want to see, do you vary, right? How badly you vary. Because some people got a really good night, and if you're with the sleep physician and he does his old style test, I'm just going to say, because theirs don't have what mine has, they don't get that RDI value. And they do one test. So if you're having a good night, they go, oh, you don't have a problem. Okay? But I see people who go, good night, bad night, good night. So I'm like, and sometimes they'll say, I need you to do a couple more nights. So these are very, very important tests. So as you think about when you take a picture of somebody, are their eyes open or their eyes closed? Did you get a red eye? Does your hair look okay? Us ladies, we're always worried about our hair. So these are important things, right? So I like to make sure that we're having as much opportunity for the sleep physicians that I work with to be able to see what's the best diagnosis based on what they're looking at. And they look at the multiple nights.
Gotcha.
Yeah.
Wow.
I know. Interesting,
It
isn't it?
is really interesting.
Yeah. So you can vary and you don't know why. Right? So you have a good night, you have a bad night.
Right, because every night's different.
Well, we all know that if we have a bad night, that's the night we drank a lot of alcohol, we went out partying, you ate too much and you can't go to sleep, you feel like you're full, right? You might get some acid indigestion.
I don't know if it's second or third time that you mentioned this. And I don't know if I just ran out of time or didn't want to interrupt you. I'm not a big alcohol drinker. And when I drink wine, I prefer red. I don't know if it has maybe this is a red wine thing. I don't know. It
has less sugar in it.
Okay. I fall asleep. Matter of fact, I've been on dates in years past where they say, no, he's not having wine because he'll poop out in about an hour and a half to 2 hours from now. This is a saying we're going out for dinner or something like that.
Yeah.
I remember you saying, however, though, you can get a restless sleep by drinking alcohol. Mm-hmm. Is it just me where if I do drink wine, then I'm out like a light and I'm fine?
You're lucky. Okay. Maybe one drink doesn't affect you that badly. I have some people, one drink is way too much. Okay. I don't drink very much because I know it's already a toxin. So it's like, how much do I want to work my liver that night? But you also, you take the chance of getting into some bad sleep. And I say this because I guard my sleep like no tomorrow. Right. So isn't that weird that I should say that, right? Because I know how important it is to get a good night's sleep because I want, as I'm getting older, we're all aging, right? So I'm not 20 anymore. And so my body needs that time to rejuvenate, to rest, to recover, to
Do you
make
need
sure
more sleep as you get older or less?
It takes us longer to get the healing mechanisms to work fast. We don't heal as fast. We heal, but we don't heal as fast because we're older. Everything slows down, right? The mechanism. So think about our energy levels. We slow down. How much do we have? We usually see thyroid slows down. You can't eat as much. You gain weight. Hormones play a big role. We've talked about this too.
Yeah,
Hormones play a big role. So how we heal our bodies is to get into that really good deep sleep. And as we age, we tend to have less of the deep sleep and more of the light sleep, which is why people feel like they wake up frequently during the night, or they don't have to get out of bed necessarily, but they don't feel like they slept really well, all right? Mm-hmm. The people who drink feel that way more than the people who drink a lot, conk out because that causes them to get tired, but then they wake up 3-4 hours later and they don't know why they are awake, and it's like disturb the sleep. So we talk about this because the hormones play a part, the body plays a part, sympathetic versus parasympathetic, all of these things. And so what do? How does your body respond? How well do you heal? How fast do you heal? Depends on your age, your health, your chronological age, and your overall body health. You know, you listen to Dr. Oz in the old days, and I'm going to say this because he was on TV and my mother loved him. But he talked about how we have different ways of chronological age versus biological age. And he used to say we can test for that, right? Interesting, because I do think that's worthwhile. I don't want to do it every year, but maybe every 10 years you kind of want to check and see how are you doing, right? So the people who tend to live, I'm just going to say quotes, a healthier lifestyle, right? They tend to have a lower biological age. So if you're 60, you might be a biological age of 50. Okay? Better for you, right? So that means that your body functioning is doing pretty good. Wouldn't you agree?
Yeah.
I also see the 60-year-olds who are like 80. And I have so many
That's sad.
so many people who are in their 40s and 50s and they look like they're 60 or 70. All right? So you look at their skin, you look at their health, they look how many diseases, how many medications are they taking. There's stuff.
Weight.
Well, weight is a problem because it's holding on to the toxins that your body's trying to get rid of. And you don't even realize that till you start getting rid of the weight, and then you're getting like, oh my God, I don't feel so good, right? People don't understand how all this works. It's more complicated. And physicians, unfortunately, and this is my big peeve against insurance companies, they don't allow them to spend enough time to be able to talk to you to know what's going on with you. They do a couple of tests. They go, okay, you're pretty good, or your cholesterol's high, or this. And so patients come in and they'll talk about these experiences. And it's like, you know, you used to be able to talk to your doctor for a half an hour. Now you're lucky if you get 3 minutes. And it's so true. Insurance companies rule the world.
We don't in any medical field. You're absolutely right.
And some of them are better than others, I will say, because I see it on the dental side. I see companies who will say, you know, if they've got diabetes, they can get an extra 2 cleanings a year. But not all insurance companies do that.
And do you think insurance companies have their biases and
they're making a profit. They want to turn a profit.
That's not really an issue. That we've got bigger issues that we've got to cover.
Well, they understand it's medically necessary. So if you get diagnosed with sleep apnea, it's a medical necessity to get it treated.
Is there any relation between sleep apnea and, like, let's say, like TMJ?
Oh, yeah, totally. Now, so I'm going to say it like this. Sleep apnea can cause and aggravate TMJ, but TMJ does not cause sleep apnea. It only goes one direction.
When you're following along at home, you got that, right? Just making sure.
So as we've talked about in other times, we have a ball and socket joint by our ears, okay? But it's hooked by a bone called the jaw, all right? Because it goes, so whatever happens on one side gets affected on the other. So it's funny, because if you break your jaw, you're going to swing to the side that is healthy. It's sort of weird. It's like it's broken on this side, but this side looks like it's all going this way. Like this is the problem side. So it's always backwards when you're looking at somebody. Right. Because the muscles, we have a lot of muscles that hold onto that jaw, which is why you can chew, why you can talk, why you can swallow. So these muscles are what open and close. Now, I had a lady who came in because her dentist couldn't do her crown. And it was the last tooth on her lower right. And she's a wonderful woman. She goes, I just can't open my mouth. I don't know why. I'm opening as much as I can. And so, you know, Gary, you and your faces, you're so funny. So she was very frustrated, and her dentist was frustrated with her. This was not this woman's fault. You know, you can't get mad at the patient because they can't open. You have to find a solution. So she's like, you need to find somebody. She was all cranky with her. And she goes, I don't think she likes me. I said, she's probably frustrated, right? Because she can't get her job done. So she's like, so she's in my office. So, of course, we were able to get her opened up. But, you know, you have to work at some of these things, and you have to explain it to people. And now she's doing great. But you know, she needed another root canal, and the woman's like, forget it, you'll never be able to get through it. And I'm like, okay, we got you open to the dentist. The root canal guy can do the root canal today if you can get in.
Talk about some of the symptoms.
Symptoms are very interesting with TMJ. Some people will get clicking, popping in their joint.
I heard exactly what you're talking about.
Right,
Yes,
right.
yes.
And you'll know those people because they sit at the table and every time they open to put the fork in their mouth, it goes click or pop.
Yep.
Right. And it aggravates them and it aggravates everybody around them. And then, this is going back to my dental school days. They were like, so if the jaw clicks and pops and it doesn't cause them any pain, you don't need to do anything about it. Okay, that's not true. That's not true. So so those people out there who are dentists, you need to think about this a little bit. We didn't get all the current information. We maybe did at the time, but now 20, 30, 40 years later, it's changed, right? So we now know that it's a symptom, okay? And I have teenagers that click and pop. Typically, it's not 100%, but typically after they have orthodontic treatment. Okay? So we make pretty teeth and we just put them in a bad position.
Right.
Okay? Because we're not looking at how the face is functioning. And it's the orthodontist is how they were trained. So, and I was one of those. They took out teeth and pushed my jaw back. So thank you for giving me sleep apnea. Okay? Now, did they intend to do that? Of course they didn't. So you have to look at them and go, they only knew what they knew at the time that they knew it, right? But we've known better for a long time, and I still see some of that going on, just saying. So, parents beware that extracting teeth is not necessary today unless we have some other issues going on, and that could be genetic and dental problems, bad tooth decay or something like that. But yeah.
Folks, you are listening to The Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at theburlingtondentist.com, where you can always click on to her YouTube channel. More importantly, I want you to get this free assessment to the first 5 callers this morning at 860-673-7155. Let me repeat that for you. 860-673-7155. Is it you? Is it your spouse? Is it your child? Someone close to you, more than likely, has a sleeping disorder. Let's find out and get to the bottom of it and get this rectified. Do you think women are more susceptible than men for TMJ?
Typically, it's 2 to 1. Okay.
2 to 1 women?
2 to 1 women. Yeah. So, unfortunately, we're the more delicate species. We feel more pain than the men do. That's because they get their testosterone that protects them against pain. I like to say you guys are the warriors,
Hey, I did it for
Exactly,
you.
exactly. And, the ladies don't quite understand, but we've got a bunch of hormones we got to deal with. So we deal with the estrogen, the progesterone, and the testosterone. And now you add a little stressors like some cortisol in there. Okay, so now we're grinding and clenching our teeth, right? So the grinding and clenching is a direct relationship to the sleep breathing, right? So one of the things that we know through research is that when people have a higher, and we talked about this here this morning, RDI value, that respiratory distress index goes up. Now it goes up for multiple reasons. That's a whole separate issue. But if they go up, we're going to see you grinding and clenching more. If you have more sleep apneic events, we're going to see you grinding and clenching more.
Really?
Because one of the things that calms the system down. So what happens when you have a sleep apneic event? You stop breathing, right? Now, sometimes it's only for a few seconds. We count those, but they're not counted as a sleep apneic event. They're counted as a hypopneic event. So that's like really weird, right? So if it's over 10 seconds, it counts as an actual sleep apnea event. Now, how much did you oxygen desaturate in that time? Because it's not when you take a breath and go, I'm going to hold my breath now. It's on the exhale. So we've exhaled, you're down to the bottom, and you have no air. That's when you'll close off, okay? Now, what happens? So think about what's causing you to breathe through your mouth, okay?
Maybe your nose is clogged?
Exactly. We're not breathing very well through the nose, and that happens about 3 to 4 hours into sleep. So the next thing you know, and that's that RDI value again. So the brain's very smart, and it goes, well, this guy's got to breathe, right? So it's going to say, okay, open your mouth, roll on your back, right? And the guys go, well, that's when I start snoring. Well, yeah, duh, right? Women do too, but not as much as men. So we all snore maybe, but we don't snore loudly.
Now, I was right about to say, I don't know about how often, but certainly not as loud.
Not as loud. And sometimes we do, but typically, people go, well, I was super tired. I was really exhausted. Okay, I get it. And that's okay. We get those days. But when you think about the dry mouth is because we're breathing through our mouth for several hours. All right. Now we've dried it out. Okay. Those apneic events close, and as soon as the jaw falls back in the face, the throat and the tongue and the tissues all get closer together. Now you're a little dry, and you go, and you get a stick. Now, obviously, you're here because you didn't die. I say to people, you didn't die. You're here. So what happens to unstick it? Okay.
Wow.
Okay. So the body goes, okay. I like to say it's like, an I Love Lucy show. The candy's rolling along on the, on that little conveyor belt, right? And so we're like trying to get the heart to race. Right? It's like, I need more oxygen, calling for more oxygen. Didn't breathe. Okay. Oh, still not more oxygen. Uh-oh. Now I have to start spasming. I have to get the diaphragm to kind of kick some air up from the stomach area. Oh, a little GERD maybe. Okay. Okay, as soon as that releases, there's a suction that happens, and we suck the stomach acid right up into the esophagus. So, and here's the other side. While that's spasming, it's pressing on the right side of the heart. Guess what the heart does? It says, oh, gee, like when us ladies were pregnant, we had to pee all the time, right? Oh, because the heart sends out a natural diuretic that says, okay, we need to fill up the bladder now. And then you wonder why you have to get up and go pee, which is why I ask how many times you have to get up and go pee. Okay? You didn't know that one.
I didn't. No.
Right. So you sit there and that's why the number and the timing is kind of important,
Sure.
right? And then people go, oh, I just drink too much during the day. Okay, well, me too. So maybe that accounts for one of my getting up to go to the bathroom, but not 2 or 3. I had one guy get up every hour. Okay, that's not normal either. So we get the natural diuretic. Now you didn't wake up still. The brain goes, bloody hell, right? So we got to get that cortisol shoot because that's what wakes us up in the morning when our cortisol levels rise. So we're going to shoot you out of bed. Like you're going to be bolt right up, okay? So I have people that say, oh my God, I'm like I sit up, bolt upright in bed, and I don't know what woke me up. But I can't go back to sleep. I'm just so upset. I'm like, I got like anxiety or I'm nervous or something along that line. So interesting, right?
I think it's fascinating, actually. But I only have about 4 minutes remaining. I've got to ask you, I think this is the golden question that if you're listening to the show, you've been waiting to have answered. TMJ, how is this treated? I mean, is there any cure for it?
Cure is a very interesting word, okay? But how much damage is done to the joint after you've done that for 30, 40, 50 years?
Oh, that long.
Oh, yeah.
Wow.
Because I see a lot of people between 45 and 65, okay? As soon as the hormones start to change, because up until then, they sort of know they have a problem, but they don't think they have a problem, right? It's not bad enough to go anywhere. And certainly the sleep physicians are going, oh, you just gained a little weight, that's fine, you're normal, right? Okay? So we pass it off. We explain it away as like that's a normal aging process. And so when I have people with TMJ and I get a variety of people for this, and I was a TMJ specialist before I ever got involved with sleep. And I used to say, okay, I could get them all fixed, right? And then they'd have a bad sleep night. And then all of their symptoms would come back. And I'd be like, what the heck? I just had you fixed, right? A month or 2 or 3 later, right? They come back in, they go, I got pain again. I'm like, really? So that starts me on this other path. There's a breathing component to it. What is the breathing component, right? So now I'm reading everything I can under the sun, and I started taking better courses with smarter people than me. So, but so TMJ can get fixed if I get the right appliance. So I call it a twofer. So I fix your sleep apnea and I can fix your TMJ.
Hey now.
Yeah.
2 for 1.
Yeah.
So when you say fixing.
So we mitigate the symptoms, all right?
Okay.
So we protect the teeth so you're not wearing and tearing, okay? If we can catch you before you're losing teeth, splitting teeth, and having those problems, that's important. The pain, because I see a lot of arthritis and a lot of joint destruction with some of these people that don't even, like they'll say one side of their face hurts, but the other side is really the cause. It's wild, okay? So we got to take x-rays and make sure that we're doing our due diligence. I had one woman that came in and she's like, her ENT told her she had a TMJ problem. So she comes into me and I said, you had a good dental exam, you go frequently, because I'm not their regular dentist. And they're like, oh yeah, the dentist said I was fine. So then I start off and I take my first x-ray and I'm like, oh, look at that. Did you know you have 3 abscessed teeth? That'll cause pain in the face. Okay? So I have to do my due diligence and make sure that we've got everything properly documented so that I make sure you get where you need to go.
Sure.
Yeah. I mean, I'm thorough.
I like how you said a moment ago, cure. That's an interesting word.
Yeah.
Well, because
But
treating
because
something and curing something are two totally
here's the
different
thing.
things.
It only works if you wear the device in your mouth, right? You could say, I'm not wearing the CPAP. Is your sleep apnea cured? No. If you don't wear the sleep appliance, you'll be right back
I
where you
bet
started
you
from.
deal with a lot of that too. It's
Actually, more people that use my appliances, they wear them.
you can lead a horse to water, they say.
Yeah, true.
I want to get back because we're wrapping this show up. I'm going to give you the points of contact again, but this free assessment, I can't stress enough. I mean, it's something that, let's face it, somebody, on an average, by the law of numbers, there's somebody in your household right now, whether you are aware of it or not, that has some form of a sleeping disorder, could even be sleep apnea. First 5 callers right now, a free assessment. This is valued at like, what, $250.
Yeah.
860-673-7155. I'm going to repeat that for you. I'll slow it down. I know. Gary, so I'm writing it down. Okay, ready? 860-673-7155. And you also might want to head to the burlingtondentist.com. Yes, they're in Burlington, Connecticut. We got that down. But go to the website because if you've missed any portion of this show or other shows, you can click on and even subscribe to their
please
their
subscribe.
YouTube channel.
Please subscribe.
Yeah. And you can find that at the burlingtondentist.com. It's really that simple. Okay, show's over. No excuse. Start dialing right now. 860-673-7155. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next Saturday morning, have a good one, everybody. So long.